name is Viviana Tenemasa. My topic is pelvic inflammatory disease definition. Commonly called PID is an infection of the female reproductive organs. PID is one of the most serious complications of a sexually transmitted disease in women. It can lead to irreversible damage to the uterus, ovaries, fallopian tubes, and other parts of the female reproductive system, and is the primary preventable cause of the infertility in women. Video.
Pelvic inflammatory disease, PID, is infection of a woman's reproductive organs. Infection spreads upward from the cervix to the uterus, fallopian tubes, ovaries, and surrounding structures. Some of these conditions are also referred to as cervicitis, inflammation of the cervix, salpingitis, inflammation of the fallopian tubes, endometritis, inflammation present in the lining tissues of the uterus, and peritonitis, inflammation of the peritoneum, the membrane that lines the abdominal cavity and covers most of the abdominal organs. All of these conditions may be considered as specific diseases, but many investigators group them together as variations of PID, especially if they are caused by either Chlamydia trachomatis or Neisseria gonorrhoeae. Bacteria can infect the fallopian tubes and cause inflammation, salpingitis. When this happens, normal tissue can become scarred and block the normal passage of an egg, causing infertility. But if fallopian tubes are partially blocked, an egg may implant outside the uterus and cause a dangerous condition called an ectopic pregnancy. An ectopic pregnancy can cause internal bleeding and even death. Scar tissue may also develop elsewhere in the abdomen and cause pelvic pain that can last for months or years. The two most commonly involved bacteria that cause PID are Chlamydia trachomatis and Neisseria gonorrhoeae, which cause the sexually transmitted diseases, chlamydia and gonorrhea.
Application in medicine. Signs and symptoms when present may include lower abdominal pain, vaginal discharge, fever, burning with urination, pain with sex, or irregular menstruation. Untreated PID can result in long-term complications, including infertility, ectopic pregnancy, chronic pain, and cancer. Video. Pros and cons. At first to the prevent disease include not having sex or having few sexual partners and using condoms, sharing women at risk for chlamydial infection followed by treatment decreases the risk of PID. Video.
But one hint that women absolutely cannot ignore symptoms of pelvic pain, lower abdominal pain, if they have painful sex or irregular periods, these are your body just screaming to go to the doctor and get evaluated because they can be signs of pelvic inflammatory disease, which is basically infection in the inside of your body. It infects your vaginal organs, and it's an ascending infection. So it starts in the vagina, it goes to the cervix, it can go into the uterus, go out to the tubes, into the ovaries, can actually cause abscesses called tubo-ovarian abscesses, which involve the ovaries and the fallopian tubes. These things can cause infertility. They can cause pelvic pain. They can cause painless sex if they're not treated soon. The most often cause of the pelvic inflammatory disease is gonorrhea and chlamydia, sexually transmitted diseases, but it can also be caused by bacterial vaginosis. So even just normal bacterial infections can cause this as well.
Dr. Lisa, this is one of those, often it is sexually transmitted, but this is one of those where if treated early, very effective treatments.
You can cure it just with antibiotics, and sometimes it's outpatient antibiotics, sometimes it needs to be IV antibiotics. So, but again, because of the sequelae, because it can cause scarring inside and cause problems with ectopic pregnancies, fertility, chronic pelvic pain, it needs to be treated.
Easy applying in Ecuador. The population group most frequently suffering from this disease, the socioeconomic law, reasons that can be attributed to poor sanitation, lack of concert of the poor general state of health, the increase in the number of sexual partners that live at high incidence of STDs is sexual, and the absence of treatment of sexual partners. Video. Conclusion is an infection of upper part of the female reproductive system, namely the uterus, fallopian tube, and ovaries, and inside of the pelvis. The disease is caused by bacteria that spread from the vagina and cervix. Infection by Neisseria gonorrhea or Chlamydia trachomatis are present in 75 to 90% of cows. Video.
The female reproductive system consists of the ovaries, fallopian tube, uterus, and vagina. These organs are vulnerable to bacterial infections, which can be caused by poor hygiene or by sexually transmitted diseases. Chlamydia and gonorrhea, for example, are caused by bacteria that enter the vagina during sexual intercourse. These bacteria multiply in the warm, moist climate of the vagina, causing inflammation, pain, and vaginal discharge. Left untreated, bacterial vaginal infection can spread to other internal organs. For example, bacteria may enter the uterus through the cervix. If this occurs, bacteria can infect the fallopian tube, where the bacteria can continue to multiply and create scar tissue. From the fallopian tube, the infection can also spread to the ovary, as well as to other abdominal structures, such as the bladder, intestines, and the walls of the pelvis. PID is the term used for the generalized infection of the uterine lining, fallopian tube, and ovaries. Symptoms of PID can include vaginal discharge, chronic pelvic pain, and fever. However, the most severe consequence of chronic PID may occur during ovulation when an egg is released from a woman's ovary. The scar tissue left by the bacterial infection may completely block the fallopian tube, such that the egg cannot pass into the uterus. The result is either infertility, because sperm cannot reach the egg, or ectopic pregnancy, a medical emergency, in which the egg is fertilized and begins to grow within the fallopian tube. If you experience any of the symptoms of sexually transmitted diseases or PID, seek medical attention. Early detection and treatment is key to preventing unfortunate medical outcomes.
Thank you for your attention. Bye.